everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about exstrophy of bladder. And this is also termed as ectopic vesicae. That means malposition or displacement of the urinary bladder from its natural position in the pelvis. And this is a congenital malformation. So in this, what happens? The lower portion of the abdominal wall and the anterior portion of the urinary bladder is missing. So if the lower portion of the abdominal wall and the anterior wall of the bladder are missing, then what would happen? The bladder would be everted out, right, through an opening, and then it would be present just in the lower abdomen, just above the symphysis pubis. So here the bladder is everted through the opening, right? So that means there will be continuous passage of urine to the outside. So this is what happens in exstrophy of bladder. Now, usually this condition is associated with some other congenital anomalies related to urogenital tract or related to musculoskeletal system, or even sometimes gastrointestinal systems. And if we say the incidence, then male children are more affected with this disease. So in general, what happens in exstrophy of bladder, that we understood. Now let us move to the meaning of exstrophy of bladder. So what does this term exstrophy means? Now exstrophy means turned inside out. And here we are saying exstrophy of bladder. That means the bladder has turned inside out. So that's what is the meaning of exstrophy of bladder. Now let us move to the definition of exstrophy of bladder. So let us see what does the definition says. So exstrophy of bladder or bladder exstrophy is a congenital abnormality of the bladder due to improper development of the lower abdominal wall, results in opening of the bladder outside of the abdomen. So from the definition, we got to know that this happens when there is improper development of the lower abdominal wall, and also this results in, opening of the bladder outside of the abdomen. Now moving on to the risk factors of exstrophy of bladder. So there are several factors which are considered to be the risk factors for exstrophy of bladder. So the first thing is, it is more common in male children. So definitely the sex is a risk factor. Also, this is more common in infants whose mothers had tobacco exposure during the pregnancy and also who were young while giving birth. And then the next thing is family history. So if either of the parents were born with exstrophy of bladder, then there is a high chance that they might have a child with exstrophy of bladder. Now moving on to the etiological factors. So the first thing is, it is idiopathic. So in most of the cases, the etiology of this condition is unknown. And then the next thing can be due to any other birth defect. So as I was telling you that usually, exstrophy of bladder is associated with some other congenital anomaly. So that again, that might be a cause. And then other than that, if there is any genetic factors or environmental factors, that can also cause exstrophy of bladder in a child. Well, now let us learn what are the associated problems of bladder exstrophy. So the first thing is epispadias. Now what does this epispadias means? So epispadias means the urethral opening would not be present at usual location or at its proper location. So in epispadias, so what happens basically, epi means above. So that means this urethral opening would be present somewhere above. So in male children, if we see, if they are having epispadias, we can see that, the urethral opening would not be present at the tip of the penis. Instead, it would be presented on the top side, right? And again, if we see in female children, then we can all again we can see that the urethral opening would not be present at its usual location, but it would be present somewhere above its usual location. And then the next problem can be widening of the pubic bones. So the pubic bones join together to actually provide support to the bladder, urethra and abdominal muscles. However, in children with exstrophy of bladder, we can see that these pubic bones do not join together and it leaves a wide opening. And then there can be vesicoureteral reflux. So if we see how urine is formed normally, then we can see that the kidneys would make the urine, and then it would drain down through the ureter to the into the bladder, right? But here in vesicoureteral reflux, what happens? It goes back, instead of coming to the bladder, it goes back to the kidney. So the urine would not follow the normal pathway, that is from the kidney through the ureter to the bladder, but instead it would go back to the kidneys. Apart from these things, there might be abnormal development of genitalia. So specifically in boys, what we can see is that the penis would appear short and curved in an upward direction. And the testicles might not be in the normal position in the scrotum, and we can also see hernia. For girls, the clitoris and the labia minora are separated and it would be spread apart. And the vagina and the urethra would be also shorter. Now moving on to the clinical manifestations. So in clinical manifestations, the first thing that we can see in the child that would be exposed bladder from the abdomen. And the symphysis pubis would be separated, and also we can see continuous dribbling of urine through the defect. And apart from these things, there would be skin excoriation and also infection and ulcer of the bladder mucosa. The next thing is how it can be diagnosed. So let us see what are the diagnostic measures of exstrophy of bladder. So the first thing is cystoscopic examination. So we can do cystoscopic examination to find out if there is exstrophy of bladder. We can also do X-ray, USG or urodynamic testing. Now moving on to the management. So first we would discuss about the medical management. So in medical management, the child will be given with antibiotics, especially third generation antibiotics, that is for example ceftriaxone. And this would help in preventing infection. So next let us see what are the surgical management that are there. So basically there are two major surgical interventions. The first one is MSRE, that is modern staged repair of exstrophy, and the second one is CPRE, that is complete primary repair of exstrophy. So majorly these two surgical interventions are done to correct the exstrophy of bladder. Next, let us move to the nursing management. So in nursing management, first we would discuss about the nursing care during the pre-operative period. So the first thing would be protection of bladder from infection and trauma. So as we know here that the bladder is exposed outside of the abdomen, and so there is a high chance that there would be infection and there might be trauma or injury to the bladder, right? So that we have to prevent. And then you should also avoid irritating clothing or linen over the exposed bladder, because that might irritate the bladder. And again, you have to make sure that you provide proper position to the infant. So you can provide, supine position, or you can also provide side-lying position to the infant. And you should also make sure that whenever you are doing any sort of procedures, you should follow aseptic precautions and you should follow all the general hygienic measures. And then you should prepare the parents and the child for the reconstructive surgery. Then you should maintain the intake and output chart, provide care for the urinary catheter, and you should maintain the catheter position and drainage. And then again, you have to make sure that whenever you are doing any sort of procedure, you have to follow the aseptic technique. And then you have to instruct the mother, you have to educate the mother about dislodgement or leakage of urinary catheter. And you should also, make them aware about how to prevent the infection. And then you should also provide necessary information and demonstrations regarding home-based care. Now moving on to the complications. So in complications, we can see incontinence of urine, infection, there can be dehydration or progressive weight loss. Apart from these things, there might be also vesicoureteral reflux, and then there might be bladder spasm, bladder calculus or urinary tract infections. Next, let us see what are the health education that we should provide to the parents. So the first thing that you need to tell them is that they have to keep the bladder clean and dry. Also, they should cover the bladder with sterile gauze to prevent infection. Also, they should cover the bladder with sterile gauze, and they have to prevent the gauze to be adhered to that area. So this was all about exstrophy of bladder. So let us conclude our today's topic here. So today we learned about exstrophy of bladder, and the term exstrophy means turned inside out, right? So that means the bladder has, turned inside out, right? So we learned that, what are the clinical manifestations will be present in the child, and then what are the treatment procedures are available for that, and if we are taking care of a child as a nurse, what are the nurse's role in taking care of a child with exstrophy of bladder. So I hope you have got a better insight about the topic. Thank you.